the bureaucracy within Health Canada that normally creates the drug identification number that each pharmaceutical product gets, they have all sorts of standards about what is or is not allowed, and so they're not used to forcing plants into that process. So that's why they've put it through these exceptional standards. They don't have to do that for it to be safe, to be sure. There's ways to test for molds and stuff, but they're going so far as to not only make sure there's no mold in the room, but then irradiate it after as if they didn't know there was no mold present.
Does the irradiating of it damage it?
Well, that's the belief. Unfortunately, there's not been much science done on the effects of it, and the science that has been done doesn't suggest that there's much damage that occurs to the cannabinoids in the plant material. So, if there was evidence to suggest that it was harmful, the courts would have a problem with it. From what I've seen with the evidence that Health Canada uses, the courts haven't seen any flaw in that and feel that Health Canada is justified putting the plant through this rigorous process to make sure that it is free of molds in particular. The THC content is also quite low in the Health Canada pot. They have said at times it's 5 to 10%. They've ground it up as well. It used to be the stalk and the leaf and everything was thrown in, and if it was 5% THC, many of us would be surprised. And so even now they grind it all up. It's not like you get buds from Health Canada, but it's ground less and apparently not dried out as much. At first it was just so dry and stemmy and stuff that it just wasn't worth smoking. And so, that is still available. Clubs have never been on the table, you could say, with Health Canada. They've refused to include anyone representing dispensaries on a steering committee that was in existence for a few years when the MMAR were brought into effect. That steering committee has not been active for a few years now. Ironically, Health Canada said that they had fixed everything and there were no problems anymore, and as such the committee didn't need to meet anymore. Despite this, there's been court decisions stating it was unconstitutional, and last year, as a result of the Splatkopolis decision, they even changed some of the regulations again, but Health Canada is unwilling to admit there are substantial and significant problems still with it, and much use of this advisory committee. Any efforts to bring that committee back to life in some sense would be appreciated, but it would not benefit clubs anymore. Health Canada's forms, and I got a copy of them that I brought here. They're not as big as they used to be. When they first put them out years ago, the initial set of forms was huge. It's maybe twice what it is now. Really a lot of reading. You were also required to have a couple of signatures if you didn't have what they considered to be a category 1, which is MS, spinal cord injuries or disease, cancer, AIDS, arthritis, or epilepsy. If you didn't have one of those conditions, you'd need 2 signatures from specialists. Ironically, while the courts told them, well, 2 signatures from specialists is too onerous, because there's no other medical product where you have to get more than 1 signature. You can walk into a doctor's office and they'll give you a bag of drugs that they're doing research on, they know very little about at times, or prescribe anything else when any individual doctor does not need to get a second opinion to prescribe a drug. They can give you the form and a minute later you're down at the drugstore scooping it out. The second specialist or second doctor requirement in some ways has been taken away, but it's just the signature. The forms, if you don't have one of those conditions I just listed, the forms require you to have your doctor consult the specialist about your case. The doctor might have only, or the specialist may have only had to see your file and talk with your doctor over the phone, but it still is this kind of extraordinary standard that's being applied here. But by having just one doctor's signature required, even though that can only be filled, signed after a second doctor's been talked to, shows how far that they're willing to go to slow things down and cut off access to this program. Yeah, so you can also grow your own and have a designated grower. So ironically, the way DIN numbers, drug identification numbers, are given out with Health Canada is when a company, or I guess maybe individual, but normally a company applies to have a drug, as cannabis is being classified as, produced, they submit standard operating procedures on the production of that drug. In this case, Prairie Plant Systems wrote up what they consider to be the best practices for growing cannabis and wrote it all down, like a patent per se on growing cannabis, and submitted their means of growing cannabis to Health Canada for standard operating procedures in the production of cannabis, and DIN number 420 or whatever it is. But so Prairie Plant Systems owns that patent, just like any other drug company owns the patent of the drug that they've sent in, right? Because Health Canada, on one hand, is required to make sure that these drugs are produced according to certain protocol. And they need to know exactly how things are being made and what's going in them. But at the same time, they don't have proprietary ownership of that private patented information. And so they require, on one hand, to have all the details before them, but they can't expose that information. They're required to keep that for safety, public safety issues, but they cannot tell people what is in that information. And so once the DIN number has been granted to a company, then they start going and doing all the research and such. But the problem for patients is that Prairie Plant Systems essentially owns the right, according to Health Canada and the law, to produce cannabis, like growing cannabis. Health Canada cannot disclose to the public the best practice